Good morning, everyone. I am here to continue to report about communication and motor disorders. Communication and motor disorders is closely related to learning disorders, but comparatively benign, early appearance, wide range of problems later in life. So, communication and motor disorders can cause weakness in the tongue, lips, vocal cords, and chest, causing speech to become faint, slurred, or unclear. It can also affect gesture and facial expression. This means communication can become increasingly difficult as the symptoms progress. But there are techniques and communication aids that can help. Motor disorder are disorders of the nervous system that cause abnormal and involuntary movements. They can all result from damage to motor system. Motor speech disorders are a class of speech disorders that disturb the body's natural ability to speak due to neurologic impairments. Communication and motor disorders type 1, childhood onset fluency disorder or the stuttering, disturbance in speech fluency, repeating words, prolonging sounds, extended pauses. It can be seen on the early childhood or the children who starts to talk. Treatment for this is psychological and pharmacological. Type 2, language disorder, limited speech in all situations. It may occur in children with other developmental problems, autism spectrum disorder, hearing loss, and learning disabilities. A language disorder may also be caused by damage to the central nervous system, which is called aphasia. Language disorders are rarely caused by a lack of intelligence. Language disorder can cause issues with the comprehension and or use of spoken, written, and other forms of language. Students with a language disorder may struggle with the form, content, or function of language. 1. Treatment for this is psychological and some cases may be self-correcting. Type 3 is social pragmatic disorder or communication disorder. When we say pragmatics, refers to the understanding and use of social language. It may include eye contact, topic maintenance, turn taking, and or the appropriate use of social cues. Okay, the following characteristics that we'll be discussing may indicate that a child is having difficulties with social language. Okay, these are the characteristics of a child having communication disorder: having difficulty interacting with peers and or adults, violate conventional conversational rules, have limited eye contact, interrupt frequently, make odd, irrelevant comments, repeat content, confuse listeners, have poor topic maintenance, dominate conversations, violate others' personal space, be unable to interpret and use nonverbal cues. Type 4 is on type 3 the treatment is psychological. Type 4 Tourette's disorder. It is involuntary motor movements or tics such as physical twitches or vocalization. Have you seen a K-drama? It's titled It's Okay, That's Love. There is a patient there having a Tourette syndrome. The actor there is Lee Kwang-soo, and his role is having this Tourette's disorder. When he is triggered by situation, danger, or something uh, that is that can cause him irritations, he would show these physical twitches or vocalizations, and the treatment for this is psychological and pharmacological. Autism spectrum disorder. Autism spectrum disorder or ASD is a neurodevelopmental disorder that, at its core, affects how one perceives and socializes with others. Um, People with ASD often have problems with social, emotional, and communication skills. They might repeat certain behaviors and might not want change in their daily activities. Many people with ASD also have different ways of learning, paying attention, or reacting to things. Sign of Signs of ASD begin during early childhood and typically last throughout a person. Okay, and then Rett disorder, a genetic condition that affects most females, is diagnosed as ASD with the qualifier associated with Rett syndrome or associated with MECP2 mutation, the gene involved in Rett syndrome. Okay, this one is, her name is Ruby and she's only 2 years old. She cannot walk due to Rett syndrome. It's hard for her. It's enough work for her just getting her hands to move. Okay, next is autism spectrum disorder, severely impaired social communication, restricted repetitive patterns of behavior, interests, or activities. Symptoms often develop before 36 months of age. Manifest across a wide range of functioning, from individuals who have limited communication skills to those who can converse with others but lack the social pragmatic skills to be able to make and maintain meaningful social relationships. Impairment in social communication and social interaction. There are three aspects. First is social reciprocity. This one is a failure to engage in back and forth social interactions. Inability to engage in joint attention. Second is nonverbal communication. There is severe forms of ASD, not pointing to things you want. And then letter B, milder forms of ASD, example standing too close to someone. And C, less severe form of ASD, lack of appropriate facial expressions or tone of voice, also known as prosody. Number 3 is initiating and maintaining social relationships, combination of deficits in social reciprocity and nonverbal communication. Causes: psychological and social dimensions. ASD was seen as a result of failed parenting. Other theories about the origins of ASD were based on the unusual speech patterns of some individuals, namely their tendency to avoid first-person pronouns, such as I and me, and to use he and she instead. On biological dimensions, genetic influences, families that have one child with ASD have about a 20% chance of having another child with the disorder. On neurobiological influences, the theory being proposed is that the amygdala in children with ASD is enlarged early in life, causing excessive anxiety and fear. On second, the neuropeptide oxytocin, or the social neurochemical that influences bonding and is found to increase trust and reduce fear. Some research on children with ASD found lower levels of oxytocin in their blood. Treatment of autism spectrum disorder. This would be reported by our next reporter on our group. And that's all. Thank you, everyone.